From New York City, the epicenter of the pandemic, this is Democracy Now!
It's a joke when Republicans say that they have urgency around this bill. The only folks that they have urgency around are folks like Ruth's Chris Steakhouse and Shake Shack. Those are the people getting assistance in this bill.
As the House passes a new $500 billion coronavirus relief bill, Congressmember Alexandria Ocasio-Cortez is the sole Democrat to vote no, saying it falls far short, failing to protect those at greatest health risk, including essential frontline workers, and could let millions go hungry. We'll get response from the American Prospect's David Dayen and from Rhea Ortiz, a domestic worker organizer in Queens, New York, the epicenter of the pandemic. Then Georgia's reopening non-essential businesses today, hair and nail salons, tattoo parlors, massage therapists, despite a rising number of COVID-19 deaths.
When we have more people moving around, we're probably going to see our cases continue to go up. But we're a lot better prepared for that now than we were over a month ago. We have the hospital bed capacity.
The Georgia governor is opening the state over the objections of mayors in Savannah, Atlanta, Augusta, and more. And we'll look at the humanitarian crisis unfolding in Gaza as COVID-19 spreads.
We know that here in Gaza, there are no resources to fight this virus. We're all in God's hands here.
We'll speak with Dr. Tariq Lubani, Palestinian-Canadian doctor, about what he saw on his recent trip to Gaza and how Canada, with universal health care, is handling the pandemic. All that and more coming up. Welcome to Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman. The novel coronavirus continues to ravage the United States, where the official death toll is rapidly approaching 50,000, more than a quarter of the 191,000 deaths reported worldwide from COVID-19. A tally by Johns Hopkins researchers Thursday found more than 3,000 people died of the disease in the U.S. in just 24 hours, and many funeral directors and medical examiners say thousands more U.S. deaths from COVID-19 remain uncounted. The disease continues to batter the U.S. economy. On Thursday, the Labor Department reported another 4.4 million U.S. workers filed for unemployment benefits over the last week, raising new jobless claims over the past 5 weeks to more than 26 million, a scale that hasn't been seen since the Great Depression. On Capitol Hill, House lawmakers went back to Congress and voted overwhelmingly Thursday to approve another $483 billion in emergency relief. Most of the money will replenish the Paycheck Protection Program set up to provide forgivable loans to small businesses. New York Congressmember Alexandria Ocasio-Cortez blasted Republicans for refusing to take up new assistance to hard-hit U.S. residents like cash payments and food aid in the latest relief bill. And she pointed to big businesses like corporate chain restaurants that got tens of millions of dollars in loans meant for small businesses.
The only folks that they have urgency around are folks like Ruth's Chris Steakhouse and Shake Shack. Those are the people getting assistance in this bill. You are not trying to fix this bill for mom and pops, and we have to fight to fund hospitals, fighting to fund testing. That is what we're fighting for in this bill. It is unconscionable. If you had urgency, you would legislate like rent was due on May 1st and make sure that we include rent and mortgage relief for our constituents.
Most lawmakers, including House Speaker Nancy Pelosi, wore masks throughout Thursday's historic proceedings, except when delivering speeches from the House floor. Pointedly, a group of at least a dozen House Republicans refused to cover their faces over the objections of their colleagues and the medical advice of the House physician. At least 34 members of Congress have tested positive for COVID-19, which has touched the families and friends of people across Capitol Hill. This is California Democratic Congressmember Maxine Waters.
I'm going to take a moment to dedicate this legislation to my dear sister who is dying in a hospital in St. Louis, Missouri right now, infected by the coronavirus.
Massachusetts Senator, former presidential candidate Elizabeth Warren said Thursday her oldest brother died in an Oklahoma hospital this week, 3 weeks after he tested positive for the coronavirus. Donald Reed Herring was 86 years old. Senator Warren tweeted, "It's hard to know that there was no family to hold his hand or to say I love you one more time, and no funeral for those of us who loved him to hold each other close," she said. At the White House, the top scientist at the Department of Homeland Security Thursday outlined new research showing the novel coronavirus suffers from exposure to warm and humid conditions and from high levels of ultraviolet light. The findings, which have not yet been peer-reviewed, suggest the coronavirus may become less contagious during summer months. President Trump seized on the news at Thursday's White House Coronavirus Task Force briefing.
So, supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
We'll get the right folks who could.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
In response, the maker of Lysol disinfectants issued a stern warning that, quote, under no circumstance should our disinfectant products be administered into the human body through injection, ingestion, or any other route, unquote. Dr. Craig Spencer, Director of Global Health and Emergency Medicine at New York's Presbyterian Columbia Hospital, responded on Twitter, instead of being asked about how we improve our COVID-19 response in the coming months, doctors are being asked to comment on why people shouldn't drink things like bleach or isopropyl alcohol. This has to stop, he said. President Trump also said Thursday he disagreed with his top coronavirus task force scientist, Dr. Anthony Fauci, that the U.S. needs to significantly ramp up testing. Public health experts say a vast expansion of both diagnostic and serology tests are needed before any states can safely begin reopening their economies. Outside the White House, dozens of drivers blared car horns Thursday as they drove along Pennsylvania Avenue, displaying protest signs reading, "Trump lies, people die," and "Give us PPE." A small group of protesters deposited effigies of body bags on the sidewalk outside the Trump International Hotel as the protest convoy surrounded the building.
Every day people are dying unnecessarily because we don't have testing, we don't have adequate PPE, we don't have adequate planning, we don't have adequate leadership. We need the president to resign.
Here in New York City, the death toll from COVID-19 is nearing 16,400, according to data compiled by Johns Hopkins University. On Thursday, New York Governor Andrew Cuomo said about 1 in 5 residents of New York City have antibodies to the novel coronavirus in their blood, suggesting infection rates are an order of magnitude higher than the number of confirmed cases. The announcement was based on preliminary results from a study that randomly sampled 3,000 people at grocery stores across New York State. If the numbers hold, the death rate from coronavirus infections in New York is about 0.5%, less lethal than World Health Organization estimates, but still many times deadlier than the seasonal flu. And the novel coronavirus remains far more contagious than influenza. Health experts are concerned about the accuracy of dozens of new serology tests that have only just reached the market with little vetting by the Food and Drug Administration. And it's still not known whether people with antibodies to coronavirus are immune to a second round of the disease, or how long any immunity may last. In Georgia, Republican Governor Brian Kemp has defied the stark warnings of public health experts and is reopening many non-essential businesses beginning today.
We will allow gyms, fitness centers, bowling alleys, body art studios, barbers, cosmetologists, hair designers, nail care artists, estheticians, their respective schools, and massage therapists to reopen their doors this Friday, April the 24th.
The Associated Press reports President Trump and Vice President Pence told Governor Kemp on Tuesday they approved of his aggressive plan to reopen businesses just one day before Trump reversed course and publicly said he opposed the plan. In California, Governor Gavin Newsom said Thursday his state had suffered its deadliest day of the pandemic, with 115 deaths in 24 hours. Newsom said it's still much too soon to end social distancing policies.
I know there's deep desire. People are making calls on an hourly basis saying it's time to open back up. Consider the deadliest day in the state of California in the last 24 hours, 8.5% increase in the total number of deaths. We saw 5.6% increase in the total number of people tested positive in the state of California.
Despite the grim numbers, California has suffered far fewer per capita deaths from COVID-19 after public health officials moved earlier than other states to order residents to remain at home while the virus spread. In medical news, a draft manuscript of a report from a long-awaited clinical trial in China finds the antiviral drug remdesivir failed to lower the death rates or recovery times of COVID-19 patients. The findings have not yet passed peer review. Preliminary results of a study by the New York State Department of Health showed the drug touted by President Trump as a curative for COVID-19, hydroxychloroquine, had no effect on patients' recoveries. Researchers at Northeastern University say the novel coronavirus spread undetected in major cities, including Boston, Chicago, New York, San Francisco, and Seattle in early February, far earlier than previously known. The researchers estimate 28,000 people in U.S. cities were infected by March 1st, when there were just 23 confirmed cases of the disease. The Department of Health and Human Services' new spokesperson repeatedly made racist comments about Chinese people and claimed Democrats wanted the coronavirus to kill thousands of people. Michael Caputo, a longtime Republican political operative and Trump ally, was appointed last week as Assistant Secretary for Public Affairs at HHS. In since-deleted social media posts archived online, Caputo tweeted, quote, "Millions of Chinese suck the blood out of rabid bats as an appetizer and eat the blank out of anteaters," unquote. In follow-up tweets, Caputo wrote, "Don't you have a bat to eat? And you're very convincing, Wang." The New York Times reports Ecuador's COVID-19 death toll is 15 times higher than the official government count, making it one of the worst in the world. The Times analysis of official death registrations in Ecuador reveal a staggering 7,600 more people died of COVID-19 from March 1st to April 15th, more than the average mortality rate in recent years. This spike is in stark contrast to the 503 deaths the government attributed to the coronavirus as of April 15th. Brazil's reported its highest daily death toll since the beginning of the pandemic, with over 400 COVID-19 deaths within 24 hours. This comes as far-right President Jair Bolsonaro continues to lash out against restrictions imposed by local governments across Brazil to control the spread of the coronavirus. In Peru, medical workers are protesting the country's hospitals' lack of preparedness, with coronavirus cases topping 20,000 and a death toll of over 500. Many hospitals are on the verge of collapse. This is a nurse at one of the worst-affected hospitals in Lima.
We have to use this face mask right now, with the exposure we are having, and to dispose of them. That is what the World Health Organization has said, which is to use and dispose. But we have to wear this face mask for the whole month. We have to use 3 face masks for a whole month. So we reuse it and reuse it. So what has happened? Where I work, colleagues have become infected.
In Mexico, hospital workers are speaking out against the recent abuse and discrimination they've received from strangers and authorities who believe doctors and nurses are helping spread the coronavirus. Over 20 medical staff across Mexico reported being assaulted, thrown off buses. Some were banned from entering their own homes. One nurse described having bleach thrown at her as she walked home after a shift treating COVID-19 patients. A new report warns Salvadoran President Nayib Bukele is taking authoritarian measures to deal with the coronavirus outbreak in El Salvador, as human rights leaders in the country say Bukele is using a pandemic to further his militaristic agenda. The report also sounds the alarm on the chronic shortage of water in El Salvador and urges the government to establish adequate protocols to ensure the protection of women, girls, LGBTQ people and others during the pandemic. In a statement, the Committee in Solidarity with the People of El Salvador, which authored the report, wrote, quote, "This pandemic will be a death sentence for those who could otherwise be saved by a humane and comprehensive public health approach." And in Puerto Rico, transgender rights advocates are demanding local authorities investigate the recent killing of 2 transgender women who were found burnt to death inside a vehicle on the eastern coast of the island. Serena Velasquez and Leila Palez are among at least 4 transgender people killed in Puerto Rico this year. And those are some of the headlines. This is Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman. Members of Congress returned to Washington, D.C. Thursday and voted nearly unanimously to approve $500 billion in new COVID-19 emergency funding. The relief bill adds another $310 billion for the Small Business Paycheck Protection Program, just as the Small Business Administration reports some 1.6 million small businesses receive funding from the program, but hundreds of thousands more still are waiting to just hear back about their application status after the program ran out of money last week. Much of the money was allocated to large corporations. The new relief bill also provides billions in aid to hospitals and for testing, but critics say it falls far short in providing funding for states and cities, and additional money to expand the Supplemental Nutrition Assistance Program, known as SNAP. More than 30 state attorneys general say the move could force 3 million people to go hungry in the middle of a pandemic. Just one Democrat voted against the bill, Congressmember Alexandria Ocasio-Cortez, who spoke out on the House floor.
On behalf of my constituents in the Bronx and Queens, New York's 14th congressional district, the most impacted district in America, calling people losing their families every day. It is a joke when Republicans say that they have urgency around this bill. The only folks that they have urgency around are folks like Chris Steakhouse and Shake Shack. Those are the people getting assistance in this bill. You are not trying to fix this bill for mom and pops, and we have to fight to fund hospitals, fighting to fund testing. That is what we're fighting for in this bill. It is unconscionable. If you had urgency, you would legislate like rent was due on May 1st and make sure that we include rent and mortgage relief for our constituents. Thank you very much.
Alexandria Ocasio-Cortez was speaking as she was holding her mask. This comes as Democrats have called for key priorities to be added to a new Phase 4 bill, including more funding for rent assistance, election security, and the U.S. Postal Service. For more, we go to David Dayen, executive editor of the American Prospect, where he writes a daily update on the pandemic called Unsanitized, his latest books, The Fight to Learn Who the Fed Will Bail Out. Welcome back to Democracy Now!, and thanks so much for joining us, David. Why don't you start off by just reviewing what happened? We just played AOC. She was the sole Democrat, along with 4 Republicans, to vote against this stimulus pack. Explain who's getting bailed out and still who isn't.
Well, it's a remarkable scene that it was in the House of Representatives to see everybody in masks, and they had to shuttle people in and clean the House of Representatives. I think they went alphabetically. The vote took about an hour. This bill it just replenishes the Small Business Lending Fund, the PPP, for about $300 billion or more. And it has $75 billion for hospital defraying of costs and $25 billion to surge testing. But it leaves out, as you mentioned, all of the very important measures that progressives have been asking for but haven't received. And now, Republicans got the small business replenishment that they wanted, and it's hard to see what the incentive is for Republicans to come to the table on a 4th round.
So why was it almost unanimous then, David?
Well, certainly, I don't think anybody is saying that this money isn't needed. I think what AOC and others are saying is that they're disappointed that this didn't have the key measures for individuals, rent relief, fixing the Postal Service, guaranteeing vote by mail for the elections in November, payroll support and things like that. And, progressives that I've talked to are very upset that leverage keeps leaking out here over and over again. In the last big bill in March, you had a giant corporate bailout. Now you've had the small business relief that has been put in, that small is a relative term. It's 500 employees or less, and franchises can still apply. So that's kind of what the Republicans wanted. And now Democrats are going to try to get their priorities through. And it's I think, going to be a pretty difficult road.
On Wednesday, Senate Majority Leader Mitch McConnell said he's against giving states more federal aid in future pandemic legislation, suggesting states should instead consider bankruptcy. This was New York Governor Cuomo's response.
As soon as the Senate passed it, this current bill, Senator Mitch McConnell goes out and he says maybe the states should declare bankruptcy. Okay? This is one of the really dumb ideas of all time.
So that's Governor Cuomo, who just met with Donald Trump in Washington. He called McConnell the Grim Reaper. David Dayen, you've written a lot about governors gaining power right now. Talk about McConnell's suggestion, let the states go bankrupt as the corporations are funded, and the rise of governors.
Yeah, I think this is for one reason and one reason only. It's to undercut public pensions. This is about public employees and trying to get out of the benefits that they earned, that they deserved over the course of their working lifetimes. McConnell and the Republicans have been ideologically opposed to public workers and public pensions for some time, and they see their moment to strike. The hole in state and local budgets is absolutely massive. About $3 trillion was spent last year on state and local government. We've only seen about $150 billion in the CARES Act, the last month's bill, fill that hole. There's probably going to be $1 trillion hole in these budgets, and so this is absolutely dire. If you want to see another depression, watch the austerity at the state and local level. States and localities can't print money. So they have to cut services or raise taxes, and so this is really dire. And McConnell seems to feel like he holds them hostage. We have seen governors rise in prominence during this coronavirus pandemic. They certainly have been able to make policy decisions. President Trump has sort of given them the ability to make policy decisions by sort of taking responsibility away from himself, and that has been great. But they run up against a wall when it comes to spending. They only have the revenues they can take in, and McConnell is trying to exploit that. It's really damaging.
Senator Elizabeth Warren of Massachusetts and Congressmember Ro Khanna, who we were going to have on today, but he lost a dear constituent to COVID-19, introduced the Essential Workers Bill of Rights. We're going to talk in a minute with a domestic worker organizer in the epicenter of the epicenter in Queens. But if you can talk about very quickly this and other demands that progressives are making right now, as clearly one after another of the stimulus bills are being passed.
Yeah, I mean, a temporary worker standard for workplace safety is absolutely critical. We're seeing our frontline workers come down sick with infections of the coronavirus. Rent is due on May 1st. And, all of these things now go into a next bill that Republicans, it's going to be hard pressed for them to deal with. But I think the key is that there's no real pressure on Nancy Pelosi. Nancy Pelosi has been a one-woman Congress for the last month or so. The constituents or the other representatives have not been involved in policymaking. I've told from one progressive organization they're going to try to get members to say out front, give us some of these demands that we need for our constituents, or we're not going to vote for this next package. They want that guarantee up front to pressure Pelosi to actually include some of this stuff and work on a bill that actually meets the needs of the American people, especially in these districts.
David Dayen, we want to thank you so much for being with us, executive editor of the American Prospect, who writes a daily update on the pandemic called Unsanitized. Well, when we come back, we speak to a leading domestic worker organizer in the epicenter of the epicenter in Queens. Stay with us.
May God bless and keep you always. May your wishes all come true. May you always do for others and let others do for you. May you build a ladder to the stars and climb on every rung grow up to be true.
Joan Baez singing Bob Dylan's Forever Young, dedicating it to the heroes of our time. Healthcare workers, farm workers, truckers, and many other essential workers. This is Democracy Now!, democracynow.org, the Quarantine Report. To talk more about how the bills in Washington have affected essential workers, let's bring into the conversation Ray Ortiz, lead organizer, case manager for the nonprofit Damayan Migrant Workers Association in New York City. Queens is the epicenter of the epicenter. Every time we talk about the number of deaths, for example, in New York City, Rhea, we actually do not actually know the numbers because in New York City alone, we're talking about hundreds of people, 200-300 people a day that are dying in their homes that are not being counted. And all too often this is happening in Queens, the most diverse borough in the world. Talk about how the coronavirus relief bills affect the people that you represent, domestic workers, who they are, what's happening to them right now.
Hi. Great. Good morning, Amy. Thank you for that question. I'm actually joining you from the epicenter of the epicenter in Queens. I live in Jackson Heights, Queens, in New York City, a few blocks away from Elmhurst Hospital, the hospital with the most number of infected patients in the entire U.S. The wailing sirens have become a staple in our community. You hear it in the morning, at night, rain or shine. I also work with the Damayan Migrant Workers Association, a grassroots organization based in New York City that serves and empowers Filipino domestic workers, babysitters, elder caregivers, and housekeepers, and other low-wage Filipino migrant workers, such as restaurant bussers and deli workers. They care for the elderly and the children, the most vulnerable during the pandemic, in the homes of their employers. This makes domestic work essential work. Domestic work makes all work possible. In our experience, on the first 2 weeks of the pandemic, we interviewed about 80 of our members, and we found out that 65% of the 80 were fired, laid off, or had their hours reduced. That's about 7 out of 10 of our members. 65 out of the 80 are also labor trafficking survivors who were trafficked by ambassadors and diplomats who work in the consulates and the United Nations, or were trafficked by placement agencies, hotels, resort owners, and rich professionals. They were already not doing well before this started. The pandemic just made things severely worse for them. The pandemic also unmasked the government's true nature. Capitalism has relegated our communities and what communities will survive and die, who will eat and not eat, who will receive care and not receive care. And my community was branded as one of the communities that will die. We found out very quickly that either our community members will die a swift, painful death due to the coronavirus in their homes, like what you mentioned, or die because of hunger, or physical, mental, and emotional stress because they're not working. Day in and day out, our members are agonized where they will get the money for food, for rent, or money to send back home because, their families are also struggling in the Philippines. So one example is a caregiver who was trafficked by a Turkish diplomat. She was caring for this elderly patient. She was very careful that, no virus would come in the house. She would care for him, bathe him, even wipe the bottom of his feet just to make sure he's very clean. But the elderly got infected through his speech therapist. And then in turn, she was infected. So she was sick, for almost 2 or 3 weeks now. She had to quarantine in their home. But because she lives with her husband and 2 kids, we just assumed that the entire family was infected. She had no insurance, no income, and no safety net that's being given to the rest of the American public. So instead, the man had to come in and make sure that they have groceries. So, we do hot food delivery. We give them groceries, money for grocery shopping. Right? We refer them to a doctor, who closely monitored their situation. Our organizers, who are also labor trafficking survivors, were doing daily check-ins to make sure that they're okay. They slept with the lights open because they were afraid that they would die while sleeping. That's the situation of the elderly caregivers who are caring for the most vulnerable in this society.
Ria, I wanted to turn to another domestic worker. This is Arlene, a Filipina nanny caregiver. She lived in with her employer at the beginning of the pandemic. The employer moved to the Hamptons in March, bringing her with them. After a month, she says she asked for time off.
There, the time that I was there in Hamptons, my work hours was changed from 8 a.m. until 10:30 or 11 p.m. If you are living with your employers, it's hard to get an off, even if you want it, and even if they say that, yes, you can. But still, when you are there, you are going to do something.
That's Arlene speaking at a Zoom news conference of Damayan, Ria Ortiz's organization. Tell us more, Ria.
Yes. So Arlene is actually one of our board members, and she worked for an employer who, like the many rich people in New York City, fled New York and went to the Hamptons, right? But, they know that they cannot survive this pandemic without their workers. So they brought Arlene with them, like many of our members. But there, she had no security. She was working day in and day out. Another member, who was asked, strongly by her employer to work live-in, was forced to work 7 days a week, 10 hours a day, so that's 70 hours a week. But, as we know, workers, even undocumented, are still protected by the law. They can only work 44 hours live-in. So that means that 26 hours were not being paid overtime, right? So I had to assist her and make her choose. Do you want to live in this situation or stay in this situation or go home, with no income? She chose to leave because the employer was actually a doctor in Mount Sinai and was sick, with fever along with the entire family. They wanted to make sure that she wasn't bringing in the virus in their home, but they were already sick, so she had to really think about her family if she would like to keep working with them.
And the stimulus bills, the effect they have on the kind of people that you're representing we're not talking about a couple dozen people. We're talking about thousands of people. I mean, if you go to Corona, you can see on a night 20 blocks long of people lining up to get food. Where do the stimulus packages play in here, Ria?
Right. Yes. So those are our members, too. Many of our members are undocumented. They're not eligible for unemployment insurance. They're not eligible for stimulus package. They're not going to get $1,200 in the mail. We have to rely on resources, that the Mayan is raising. So the National Domestic Workers Alliance is actually giving $400 financial assistance to any domestic worker who's struggling right now. So we're making sure that members of our community is availing that. We're also doing food delivery because, they've been out of work for almost 6 weeks. So there's not... Things are being done, but it's not enough to serve the workers, the domestic workers who are essential workers, and keep the city running.
Ria Ortiz, I want to thank you so much for being with us. She is a domestic worker organizer, lead organizer, case manager for the nonprofit Damayan Migrant Workers Association in New York City. Newsweek called her one of the heroes of the pandemic. This is Democracy Now!, democracynow.org, the War and Peace Report. As we turn right now to Georgia. That's right, Georgia. Georgia is opening up for business today. It's reopening non-essential businesses despite a rising number of COVID-19 related deaths in the state and the objections of the mayors of Savannah, Atlanta, Augusta, and many more. As Georgia's death toll passes 900, the number of confirmed coronavirus cases hits 22,000. Governor Brian Kemp, who beat Stacey Abrams in the election, has ordered hair salons, tattoo shops, nail parlors, gyms, barbershops, bowling alleys to reopen. Restaurants and movie theaters are set to reopen Monday. Public health officials warn lifting strict social distancing measures will lead to more deaths. This is Governor Kemp speaking earlier this week.
When we have more people moving around, we're probably going to see our cases continue to go up. But we're a lot better prepared for that now than we were over a month ago. We have the hospital bed capacity.
The Associated Press reports President Trump and Vice President Pence told Governor Kemp on Tuesday they approved of his aggressive plan to reopen businesses. Just one day before, Trump reversed course and publicly said he opposed the plan. On Thursday, the Southern Christian Leadership Conference issued a strong warning to the governors of Georgia, Texas, and other states who are considering reopening their economies. SCLC President Dr. Charles Steele Jr. said in a statement, "We cannot use poor people as sacrificial lambs like they did to people during the Tuskegee experiment. The businesses that are being reopened are the ones where poor people have to work and put their lives at risk." Well, for more, we're going to Pine Lake, Georgia, where we're joined by George Chitty. He's a public policy director for PadSplit, an Atlanta-based affordable housing organization, former city council person for Pine Lake, former reporter for the Atlanta Journal-Constitution. George, thanks so much for joining us. Can you explain what is happening? If you were going to make a list of the businesses that should not be open right now. I mean, if you ask the public health officials all over this country, including Georgia, I dare say they would make the list of the non-essential businesses that the governor is opening today in Georgia. Why is this happening? Please explain.
So my sense of it is that it doesn't really have to do with public health at all, because I can't imagine somebody really needs a mani-pedi right now. And let me preface this by saying that even though massage parlors and bowling alleys are supposed to be able to be open, nobody's going. There's widespread skepticism here in Georgia about doing any of this. I think that this is about reducing the potential unemployment insurance costs to the state. The order to open these businesses supersedes an order that he made to close these specific businesses a few weeks ago. But earlier this week, we started to see projections about what the budget shortfall was going to look like in Georgia. We're looking at $4 billion that we weren't going to have before. And the unemployment fund has about $2.6 billion in it. That's going to be a crisis in about a year, and I think the governor is trying to act now to avert that crisis later.
But explain what the connection is. Are you saying that if he says you can go back to work, then those people who work in these places can't file for unemployment? They can't say, no, I just decided to stay home once he said they can go back to work.
So it's a little more complicated than that because people can file. The question is whether or not their filing will be accepted, whether or not they'll actually get money and how. If your restaurant reopens, and some restaurants are going to reopen, and they call back their employees and say, hey, we need you to be a server, but the employees don't believe that they've got enough personal protective equipment or whatever, or they just believe that they're going to be sick, well, they'll file for unemployment. But then they've got to make the case for their unemployment before the Department of Labor. It's not a slam dunk. If the business is closed, of course they're going to get unemployment insurance. But if the business is open, well, according to the Department of Labor's standards right now, fear of infection alone is not a sufficient cause for unemployment coverage. Basically, it's setting people up for a fight that might take 2 weeks, 3 weeks, 4 weeks longer. And frankly, some people are going to give up. And I think that's what they want. They want people to give up their attempt to get unemployment, find a job that might be substandard relative to their skills, and keep from hitting the public dime.
So can you give us a breakdown, George Chitty, of the people who work in these businesses, an economic and racial demographic breakdown?
So let's start with nail salon, because nail salons, I mean, really, nail salons.
How do you do that without touching people? And, of course, people can wear gloves, but you have to be so close. When we talk about arm's length, that is far less than 6 feet.
So the nail technicians, there are health and safety guidelines that have been released. And Like it essentially turns a nail technician into a licensed practical nurse. There's no way they're going to be. Everybody gets a mask. Everybody needs a new mask for each new person.
That's more than doctors and nurses get in this country right now.
Right. There's no way they're going to be able to get their hands on that kind of equipment. That everything's got to be covered in plastic and then recovered after every person comes through the nail salon. Temperature checks for everybody who walks through the door. It's absurd. Like nobody's actually going to be able to.
Can you talk about the governor's relationship? He's a close ally of President Trump. AP is reporting that both Trump and Pence told Kemp that this is a good idea, and then reverse course after enormous pressure from the top government scientists on President Trump, and now are saying that Kemp is making the wrong decision. Is it possible Kemp will go back, since you haven't even hit the peak in Georgia right now? The deaths are vastly increasing each day.
So people are arguing that we peaked a week or two ago. I don't believe that that's true. Like, our numbers are increasing, and they're, like, that slope doesn't look like it's anything like a decline yet. Trump's going to Trump. I mean, Trump is about what he is good for Trump. And honestly, I think he put his finger in the wind. There's massive skepticism of the governor in Georgia right now. Nobody wants to do this. There's no upswelling of desire to go bowling right now. And frankly, I think he got feedback from the ground and said, it's better for me, Trump, to throw Kemp under the bus so that I don't look dumb.
So can you talk about the scheduled protest that was called off to reopen the state because the governor said, don't worry, I am reopening the state? You've spent much of your time, George Chitty, following the alt-right in Georgia. Talk about the people who make up this pressure group and how powerful they are.
So there are a bunch of yahoos who are we have a problem with the alt-right in Georgia. Let's start with that. We had a terrorist cell of alt-right terrorists arrested about 2 months or so ago, just about an hour west of Atlanta. They were planning to attempt to assassinate people who were aligned with the Antifa movement. It's AstroTurf, though, mostly. The protest movement here in Georgia was being pushed primarily by political groups that have an agenda. And those political groups weren't, when Trump started to come out and say, oh, yeah, no, this isn't a good idea, I could see the pullback happening. Some of the protest groups, some of the folks who were protesting were anti-vaxxers in Georgia. Like, one of the main protest leaders is an anti-vax person. But the rest were 3% militia people, and they're a real problem.
Very quickly, the CDC, the Centers for Disease Control and Prevention, is headquartered in Georgia, right, in Atlanta?
Yes, it is.
Final comment.
We know better. Just this, whatever you're seeing from our governor, the people of Georgia know better than this. Like, we're staying home. We're not just social distancing. We're shaming other people who aren't social distancing. This order has nothing to do with public health. It has everything to do with the financial health of the state. And I'm sensitive to that. Like, we're going to have a real problem in about a year. But I think it's important right now to deal with the health crisis that we're looking at right now.
George Chitty, I want to thank you for being with us, Public Policy Director for PadSplit, an Atlanta-based affordable housing organization, former city council person for Pine Lake, former reporter
and a columnist for Decatur-ish.
And the columnist for Decatur-ish. Thank you so much. This is Democracy Now! When we come back, it's been described as an open-air prison. So what does it mean when COVID makes its way there? We're talking about Gaza. Stay with us.
She tied you to her kitchen chair. She broke your throne and she cut your hair. And from your lips she drew
The choir of Rodin School in South Africa singing Leonard Cohen's Hallelujah virtually. This is Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman. We're turning now to Gaza, where fears continue to grow about what a rampant outbreak of the coronavirus might do to the occupied Palestinian territory, already crippled by years of Israeli sanctions. The Gaza Strip thus far has only reported 17 confirmed cases of COVID-19, but this week the Israeli army halted testing there after just 2 days of administering tests. On Thursday, the International Committee of the Red Cross donated medical equipment to Gaza hospitals, but its weak medical system remains ill-equipped to serve an influx of patients. The Red Cross reports Gaza has just 93 ventilators for a population of more than 2 million Palestinians. This is Gaza Health Ministry official Abdul Latif Al-Haj.
Facing this COVID-19 as a pandemic, Gaza is facing this pandemic with its fragile and overstretched health system due to lots of factors like the long years of closure and siege and poverty and loss of, shortage of many resources.
Crowded refugee camps in the occupied territories are particularly at risk. This is Shadi, a Palestinian woman living at a refugee camp in Gaza with her family, speaking to the BBC.
We know that here in Gaza, there are no resources to fight this virus. We're all in God's hands here. People don't have enough to eat, and there is no work. Had there been any means to work, we would have helped ourselves, but we can't go out there. I borrowed money to buy food for this week, but next week, I might not be able to borrow anything to feed these kids.
For more, we're joined by Dr. Tarek Loubani, Palestinian-Canadian doctor, emergency room physician based in London, Ontario, Canada. He volunteers in the Gaza Strip, returned from a trip there last month. Dr. Loubani recently wrote an op-ed in the Washington Post headlined, "Gaza is an open-air prison. As COVID-19 spreads, it's time to lift the siege." Dr. Loubani, it's great to have you back on Democracy Now! Talk about the situation there before we talk about what's happening in Canada, as you are an emergency room doctor. What's happening in Gaza?
In the Gaza Strip right now, we see a situation in which very clearly we're not able to detect the active cases that are happening and are definitely circulating within the Gaza Strip. Testing is severely limited. There have been fewer tests in Gaza so far throughout the entire pandemic than there were in South Korea yesterday. And so we know that we don't see all of the cases that exist. We know that we don't have the capacity to treat, and we know that these cases are not just circulating, but are also about to spike in terms of their severity and consequences.
And talk about the latest news that we have out of Gaza. But first, I want to go to the world-renowned linguist, political dissident, Noam Chomsky. I just had a chance to speak with him a week or two ago from his home, where he's sheltering at home in Tucson, Arizona, and asked him what the coronavirus pandemic means for Gaza.
International institutions have pointed out that by 2020, that's now, Gaza will probably become barely livable. About 95% of the water is totally polluted, place of disaster. And Trump has made sure that it'll get worse. He withdrew funding from the support systems for Palestinians in Gaza and the West Bank. UNRWA killed the funding. Palestinian hospitals killed the funding. And he had a reason. They weren't praising him enough. They weren't respectful of the God. So therefore, we'll strangle them, even when they're barely surviving under a harsh and brutal regime.
If you could expand on what Professor Chomsky is saying, Dr. Tarek Loubani, and I mean, you have direct experience in Gaza, have been there a number of times. In fact, you were shot by the Israeli military when you were there, as you were there as a medic helping people in Gaza involved with a nonviolent protest who were being gunned down.
The situation in Gaza has been terrible for years. I've been going there for about a decade. And one of the things that always shocked me is that each trip I think to myself, this cannot possibly get worse. And then each trip, it does. And this was truly one of the worst visits that I had had we had some improvement in electricity. We were up to 5 or 6 hours a day of electricity, and people thought, wow, that's so wonderful. But in the hospitals, all of our supplies were out in general, even without anything. We barely have enough gloves to proceed day to day. For example, usually I would carry a pair of gloves in my pocket and then only put one when I treat a patient so that I would spare the other one. And then with my bare hand would try to touch maybe areas that weren't as contaminated or sensitive. It's really a situation in which something like the coronavirus is bound to keep spreading, and a situation where I understand that there are lots of geopolitical factors that are at play here. And I just think that what we need right now, if Palestine is this open-air prison, or if Gaza is this open-air prison, is just a moment's parole. This situation is so severe and so dire that it's not only going to impact on the Gazans, though I think that they should be the main consideration, but it's also going to impact on everybody around. The virus does not care about the geopolitics. It will go to Egypt, it will go to Jordan, it will go to Israel, and it will affect all of those populations and make it impossible for them to control their COVID situation.
So what has to happen there, Dr. Lubani?
Absolutely, the first thing that has to happen is an unrestricted permission for all medical aid, medical supplies, and medical personnel to enter. That is number one. It must happen effective immediately. And we have all within the medical community not been requesting or demanding that the Israelis do this. We've been begging that the Israelis do this. This is not a situation, I think, in which there can be much pride or ego about it. This is a situation of absolute catastrophe. And the Israelis really do, in a big way, hold the keys here. And so that's why so many of us are imploring them to just stop for a moment with the severity of the siege. And then, you know what, we can go back to status quo once this disaster is addressed. The second thing, of course, is we can't treat what we can't see. And so we need those tests to resume immediately, even if there isn't an unrestricted lifting of the siege for medical personnel and medical equipment. At the very least, the tests have to start flowing. And then thirdly, of course, one of the disasters that's happening right now, there are about 2,000 people in quarantine, but the people who are trying to support them in quarantine don't have any PPE. And so the first 2 cases were people who had come from outside, but the next 15 cases were people who had been in contact with those people. In Gaza, it's slightly different in the West Bank. And so we need really personal protective equipment. We're trying, the Gazans are trying, and people in West Bank are trying to make their own, as they are elsewhere, but it's impossible to do that under the current conditions.
Finally, we only have a few minutes, but I wanted to go to where you are right now, to Canada. You're based in London, Ontario. You're a Canadian doctor, emergency room physician. Can you talk about how Canada has approached this, how it compares to the United States, the massive lack of testing and PPE, personal protective gear for the doctors, the nurses, the custodian, the cleaning staff at all of these hospitals? What has it been like in Canada?
Obviously, the situation in Canada is much better than the United States, and I think we can really chalk that up to a couple of factors. One of them is the fact that we have a medical care system that will care for anybody under any condition without payment at the point of care. Of course, we pay for our medical system, but we don't do it when we show up to the hospital. Nobody asks for a credit card or a bill. And if people aren't able to pay who aren't covered under the health system, then we take a risk-based approach. And obviously for public health, everything is covered. The other big aspect here is that people, of course, are worried about poverty. Canada is no panacea, but they are not as worried about poverty because there are some social safety nets. And so the real pillars of the response are things like making sure that everybody can access health care. Well, we have that in Canada. Making sure that everybody can stay away from work and not be worried about ending up on the streets. Well, it's not as good as we want it, but we have that in large part in Canada. Canada has many problems, of course, but when we look to our neighbors in the south, it's obvious that the way in which Canada has set up its system and guaranteed care has reduced the caseload tremendously and is giving us a fighting chance.
And finally, you just had one of the worst massacres in Canadian history. 22 people dead, it looks like, at this count. In Nova Scotia, you have this 51-year-old man who posed as a police officer. Apparently, AP is reporting he just had a fight with his girlfriend. She survived this attack, but so often these mass shootings are related to domestic violence and abuse of women. Now the Prime Minister Trudeau is talking about tightening gun rules in Canada. If you could just overall comment on what this has meant for Canada. There will be a news conference today. Will they be releasing the latest information around this?
I'm from the east coast of Canada and still have family there, so this did hit close to home for me. I think as an emergency physician, we see the impacts of gunshot wounds and we see the impacts of domestic violence as well. And of course, in domestic violence situations, having the availability of a gun is a surefire ingredient in the recipe for disaster. And so, of course, as an emergency physician, I applaud the Canadian government for doing what they can to improve gun control regulations. I don't know enough about the situation in Nova Scotia to comment very intelligently, but in general, with what we see with gun-related violence, it's obvious that even though Canada, again, does a better job than the United States with gun control, there's still some way to go. And Canadian doctors have called for this in a concerted way over the past few years.
Dr. Tariq Loubani, I want to thank you for being with us. Palestinian-Canadian doctor, emergency room physician based in London, Ontario, Canada. We'll link to your piece in the Washington Post on what's happening in Gaza. Democracy Now! Is working with as few people on site as possible. The majority of our amazing team is working from home. By the way, if you want to get our daily quarantine report, Democracy Now!'s daily show and all its reports and transcript, video and audio podcast form, you can send the word Democracy Now! One word to 66866. Text the word Democracy Now! One word to 66866 or sign up online at democracynow.org. Democracy Now! Is produced with Renee Feltz, Mike Burke, Dina Guzder, Libby Rainey, Nermeen Sheikh, Carla Wills, Tammy Warrenoff, Charina Nadura, Sam Alkoff, Tamery Astudio, John Hamilton, Rabbi Karen, Hani Masood, Adriano Contreras, Maria Tarasena. Our general manager is Julie Crosby. Special thanks to Becca Staley, Miriam Barnard, Paul Powell, Dennis Moynihan. I'm Amy Goodman.